Hey everyone. Now that I've been working in the emergency department for a while, I've learned a few things about how an emergency room functions, and I thought it would be valuable sharing what I think people should consider before entering the emergency room. On this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a new video every week. Also, be sure to give the video a thumbs up if you found it useful, as it helps others see the video as well. Many of us will visit the emergency department at some point in our life. You probably know someone or you yourself have been to the ER for whatever reason. And remember, many people come to the emergency department from broken fingers to being resuscitated due to illnesses or accidents. This means there is such a broad demographic that the emergency department serves. Having said all of this, let's talk about some of the things you should know if you have a family member or you yourself are coming into the emergency department. If you or a loved one are coming to the emergency department, it is always wise to bring a list of medications you have been taking. Medication lists are important as they tell us a lot more about how the treatment of your disease or condition is being managed. There are certain modifications that may need to be considered if you're taking certain medications on a regular basis. These modifications range from inserting an IV to the physician ordering certain tests. As a result, it is always a great idea to bring things like blister packs or your medication lists to the hospital. In addition to this, it is important for you to bring those medications with you. The emergency department is a place where anything can happen, which may delay your stay for longer than necessary. However, physicians will typically make a judgment call on what they think is best for each and every single patient. This means that they will treat patients based on what they think is the most life-threatening first. As a result of this, like I mentioned, visits at the hospital may be much longer than what you anticipate, so it is always a great idea to bring your medications that you regularly take. However, that is not to say that it is safe for you to take those medications when you come to the hospital. Like I said previously, sometimes medications may interact with certain tests and procedures, lab work, or maybe the reason you're actually in the emergency department. With that being said, it is still a good idea to bring the medication and ask the nurse or the physician if it is safe to take them. The last thing I want to mention you should have when you come into the emergency department is patience. There are a lot of situations that may not seem to make sense or why certain things are done in a way. However, the hospital has a lot of policies that are in place to protect every patient and make the experience in the hospital as efficient as possible. It gets complicated, but the point I'm trying to make is that what may seem to be inefficient on the surface level may actually be the best decision for every patient, and it goes beyond sometimes the provider's levels of understanding why certain things are done in a certain way. Therefore, it is always important to be patient with the nurses and other healthcare professionals as we're trying our best to serve the public the safest and the most time-efficient way possible. I hope this video has brought you any value. I would love to know if you're willing to share any experiences you have had at the hospital and what recommendations you have for other patients. Thank you so much for watching this video, and I'll see you in the next one.